Greetings everyone, I'm Dr. Twapas from Usahihi Health Group, and for today's health talk we wanted to highlight on hypertension, a disease that is commonly known as high blood pressure. And by definition, high blood pressure is a condition when the force that is exerted by blood on the blood vessel walls is consistently high to the extent that it can result into damage to the kidneys, it can result in damage to the brain, damage the heart itself. Now, how do we diagnose high blood pressure? High blood pressure is actually diagnosed when you come to the clinic. We ask you to sit down, rest for a while. After you've rested for a while, we take the blood pressure reading using a blood pressure machine, and when we get a figure that is consistently above 140 or above 90 millimeters of mercury, then we can definitely say that you have a high blood pressure. Now, that actually brings me to the different categories of blood pressure. So we have mainly about 4 categories of blood pressure. That is a reading that is less than 120 over 80 millimeters of mercury. That one we categorize it as a normal blood pressure. Of course, you have to consider the lower limits of the normal blood pressure. Then we have elevated blood pressure. That is a reading of between 120 and 129 over a figure that is less than 80 millimeters of mercury. So what brings about the elevated blood pressure? It's mainly the body's responses to the natural happenings in the environment. Perhaps you are from doing physical activity, you're having constant stress, or you are having elevation in certain hormones like cortisol itself. And then now we will move on to stage 1, hypertension, what we also refer to as a pre-hypertension. That is a reading from 130 to 139 over a reading that is 80 to 89 millimeters of mercury. Now, a pre-hypertension means you are on your way to developing high blood pressure, and actually you need to act. It's like if we look at the road traffic lights, you are on the orange traffic light at that moment, so you need to act. Then we have stage 2 hypertension, or something that we call a fully blown hypertension. Now, a reading that is above 140 over above 90 millimeters of mercury. Here now you actually need to be put on medications. Then again, even when you have hypertension, you've already been diagnosed with hypertension, there is some other blood pressure again that we are so much worried about, and that is a reading that is above 160 millimeters of mercury. Because why are we worried about this thing? Because at the end, you are more of like a time bomb. Anytime there can be a rupture of the small blood vessels in the brain, resulting into a stroke. A consistently very high blood pressure also results into damage to the kidneys. And now when there is a damage to the kidneys, it complicates the whole process of managing the disease. Just like we all know that the damage to the kidneys by itself is one of the causes of a hypertension or a high blood pressure. So when there is damage to the kidneys, when you're already having a high blood pressure, it means now it complicates the whole thing of managing hypertension. So now we've known the different types of blood pressure, and we have also known the definition of hypertension or a high blood pressure. Now the other thing that we need to understand is how do we manage a high blood pressure. Now when someone has, for example, a blood pressure that is from 130 to 139 over 80 to 89 millimeters of mercury, remember that's what we called a pre-hypertension. At that stage, we need to act. We need to do something about it. And most of the time when we diagnose this from the hospital, in the clinic, we encourage someone to do some kind of lifestyle modification, because a blood pressure within that range can actually be managed by lifestyle modification alone. But if there are other underlying risk factors like a family history of blood pressure, then perhaps someone may need to be put on a single antihypertensive. Then when we diagnose a fully blown hypertension or high blood pressure, a blood pressure of 140 and above, actually we want you to be both on lifestyle modification, then also medications, because these are the two major modalities that we use for managing a hypertension or a high blood pressure, as you may know. Now, why should we all be worried about hypertension? We need to be worried about hypertension because of so many reasons. A high blood pressure or hypertension can result into damage to the brain, commonly what we call stroke. Imagine you are an adult, maybe perhaps you are a father or you are a mother, you're taking care of your toddlers, and you've developed a stroke. Remember, a stroke by all means will leave you with some residual comorbidity. Perhaps you will develop a paralysis on your right hand or on your entire right side. You will lose the capacity to do some of the things that perhaps you're doing as a means of earning money to survive. If you're an individual like me who plays some musical instruments, you will lose the ability to play the music. You will also lose the ability to do your hobbies. So we should be worried about a hypertension because it can become that worse. Then a hypertension by itself can result into kidney damage. And when we have kidney damage, it reaches a point where actually you need a dialysis. And imagine dialysis, by the way, recommended cycles is 2 cycles in a week. I don't know if you will be able to afford that. When you're trying to survive and you have these medical bills of dialysis that you need to pay for on a weekly basis, it complicates the whole situation. So those are some of the few consequences of unmanaged hypertension and why we all need to worry about it so much. So for our people who already have the disease, at Usahihi Health Group, actually we are focusing so much on lifestyle modification and managing the condition if it's already there. We want you to be able to keep the disease at the stage where it is, because these diseases, once we develop them, they continue to progress to terminal stages or end stage, where either we need a replacement of the organ or we need artificial support from machines like the dialysis machine and so forth. So for people who already have the disease, we encourage you to be adherent on your medications, because when you're adherent, you are able to maintain the function of, for example, if your kidney is damaged to, say, I could say it's at 60% is damaged or 60% is still working. So when you find it at that stage, you need to maintain it at that functionality, because when you're able to maintain it at that functionality, you save yourself the burden of taking more than 2 or 3 combinations of medications. And at the end of the day, it's both a cost saving strategy, but it's also something that helps you to live close to your normal life. Thank you very much. I remain Dr. Tuapas from Usahihi Health Group, and we always encourage you to take charge of your health every day, because health is precious, health is wealth. When you're healthy, you're able to enjoy your life and you're able to do the things that you've been doing and the things that you hope to do in the future. Thank you very much.